All right, thank you. I am called Richard Mangwi, Ayiasi. I'm from the School of Public Health at Makerere in Uganda. I have been a researcher on this, on the rebuild team, particularly participating in Project 4. And Project 4 focused on deployment policies and how they were implemented in terms of the processes and the effect of these policies on the human resources for health. The country of interest for us was Uganda, and particularly the northern part of Uganda, where the conflict was mainly focused. But the rebuild project, of course, spanned across different countries, including Zimbabwe and Sierra Leone. So, why did we do this study? Our aim was to examine how policies change, human resource policies for deployment, particularly in this different conflict setting, and how they were implemented during the conflict and after the conflict. So in our case in northern Uganda, we chose 3 districts which were the main epicenter of this conflict. The 3 districts were Gulu, Kitgum, and Amuru districts, and all in northern Uganda. At the same time, we identified a large employer with which we could compare these deployment policies. In this case, we chose Lacho Hospital, because Lacho Hospital has one big hospital and it operates 3 other satellite health centers. So it was a good comparison to look at how Lacho, as a faith-based organization, used their policies to deploy their staff across the different facilities. So what did we do in this study? We looked at policy, we reviewed policy documents to see what were the policies at that time. We conducted key informant interviews and in-depth interviews with managers at the top central level, with the local government levels, and health workers in Lacho as well as in the public sector. So our key findings in this study were that, one, the policies did not change so much over time, but there were certain things policies that were evolving. For example, in the public service, we found that decentralization was introduced at the time of, during the conflict, and this continued throughout the conflict and after the conflict. At the same time, in Lacho, we also found that there was an evolving policy. For example, the framework for human resources was changing. Initially, there were very informal systems, and then later on, there was an establishment of a human resources for health unit, which was headed by a human resource officer. This did not exist before. So anyhow, this evolution of the policies were definitely not necessarily related to the conflict, but this was an important finding for us, that while the conflict was going on, there were other policies that were changing with time, and this also affected the way managers implemented the policies during and after the conflict. Now, in terms of the implementation, I think this is where our main findings were. While the policies did not change, as I said before, managers in both public and Lacho implemented the policies with some, I would say, pragmatically, in the sense that they interpreted the policies to suit the situation. I'll give some examples. In the case of recruitment, for example, Lacho Hospital was able to recruit without going through formal procedures of interviews and selection and so on. They selected the best performing students and engaged them through bonding. Others were provided scholarship, for which then they were bonded to work for a number of years. On the other hand, we looked at transfers. A lot of the transfers were negotiated. Health workers would negotiate where they want to go and whether they want to move or not. And sometimes the deployment of couples was also negotiated. Some couples decided they should be deployed separately, especially during the conflict, partly because if there was an attack, it was believed that, well, we have one part of maybe the head, the husband or the wife may be affected, but you may have one partner being able to take care of the rest of the family. What you would say, not putting all your eggs in one basket. The implications for our study, we really think that findings from our study, which we looked at conflict, is a very important inquiry that we have done, in the sense that the regions that we are working in today still are prone to conflicts, and there are likely to be many other conflicts across the region. So the lessons that we have learned from here are going to help other different contexts, different countries, on how to adapt to especially deployment issues should they arise. And in our case, we really want to make this suggestion that when conflict of this nature arises, it's important to support the local managers to help them make these decisions on how to interpret the policies, and also how they can be helped to move staff around so that it helps them to help the deployment processes across the different conflict-affected areas. So in brief, I think these are the issues that we so far have found in our study project for deployment policies in